I could not wait to be here. I am absolutely thrilled about it. This is such an exciting event, and I think anybody that works in hospital work, even the CEO, our whole purpose for being is to make sure that our communities are cared for, and what better place to do it than here at Mission 2010.
Not having health insurance for anything, being my age, in my 30s, I'm fit. I can't qualify for any Medicare, anything that the state or the county provides. And when I'm not working, I don't have any money coming in except for $20 here and $40 there. That's just enough to put in a gas tank. So it's tough. You can't do stuff for yourself when you're taking care of somebody else.
I was kind of overwhelmed at the numbers of people that really need help. I mean, you see the statistics and all the numbers that come down saying how people are uninsured and they need help, but seeing them in line out here, it's just something else to see how many really need it, and you can count and see the individuals rather than just seeing them as a statistic.
I feel like a throwaway. I worked hard all my life, so very hard. And you can't afford health care, you can't afford dental care. After all this work, I drove tractors for my dad up until I was started school and stuff like that, and then in the evening I worked for him on the farm. And I get sick and I'm not needed, and I can't find nobody to help me.
When I first walked in, the first thing I thought of Katrina, because this facility is actually owned by the city of Greenville, and one of the first events if you want to call it that, was housing Katrina evacuees after the hurricane. But it's really heartwarming to be able to use this facility not only for Katrina evacuees, but also for events like this where we can partner with so many great organizations and meet a need in the community like we're doing today.
Live at the Carolina First Center in Greenville, where people are lining up for free medical care this morning. I just think the theme is that there's a need. You know, people say, well, what do you do if you're unemployed? How do you get health care? This is unfortunately what you have to do. The nice thing is that there are volunteers out there, there are people who care enough to dedicate their time and donate their services and their expertise for people to be able to be treated.
I seen it on TV.
Really?
And I was having problems. I was hurting. I was supposed to go to the emergency room, as a matter of fact, because I got to hurting so bad in my back. And I said, well, maybe those people, and I thought I had something wrong with me real bad. They checked me out, and it was real good.
I almost died of tonsillitis. My hospital bill was $13,000. $13,000? I'll never see $13,000. If it was something realistic, I might be able to afford to pay it. If they sent me a hospital for $600 bucks, I'd start sending them $20 a month, whatever I could afford. But $15,000, I honestly can't. And I tell them, I honestly can't pay that. But I haven't had to tell anybody that here. I haven't had to tell anybody that I'm unable to afford something.
When you start talking about health issues, which we debate all the time, it's great to see something in motion providing to those who otherwise would not have access, to see that in motion and actually see the rubber meet the road.
You know, people wait in line to get an iPod or a telephone or something. I don't have any of that stuff. I can't afford that. I'm on disability. I needed medical help, and this was a godsend for me. I can't thank all the doctors and nurses and the volunteers who've put their time out here to help the people of the surrounding counties and areas who need this help.
I've had goosebumps the entire morning. What's so cool about it is that people are stopping and saying, this is the most incredible experience, thank you. I've talked to so many people that have lost their jobs, that are uninsured, and they're so thankful and they feel so blessed that this is here today. And so from my perspective, we are truly, truly helping the communities in the upstate, and it's a remarkable experience.
You know, this has been fun. I think the staff is having fun and the patients are wonderful. They're so grateful. I mean, they've waited hours and hours to see us, and they're just, it's been a pleasure.
I mean, I'm just so happy. Like, this is the only monkey I have on my back. The only problem that we had was that I couldn't do this thing. Like, even the eye exam, you know, we keep trying to save up that $100 just to go get, not glasses, just the exam. And every time we get close to $100, a bill comes. And I mean, it's just constantly trying to work towards this goal that's only just right over there. And then today, I'll take all my goals, and we're just like, oh, we'll just move all of the hurdles back behind you. You know, all of these major obstacles are now behind me, just in one day, in one little sitting.
I hope this happens again before a year. Because hopefully I'll have a job by then, but you know, medical insurance is so expensive. It's, you know, even if you're trying to pay for it on your own, you just can't, it's cost too much money. You just can't do it. And to know that I can get my medicine at least for 6 months without having to pay is a big burden off of me and my husband, both of us.